Hospice has been around for 50 years in the U.S., but do you know how it got started? To celebrate National Hospice and Palliative Care Month, we're talking about hospice history. You're listening to Heartbeat from the Heart of Hospice. I'm Jerry Finter, here with Helen Bauer.
Whether you're a family caregiver or an end-of-life professional, we're here to enhance your hospice experience by connecting you with information you can use about end-of-life care. Because we know how busy life can get, Heartbeat is designed to give you helpful information in a bite-sized format.
At the Heart of Hospice, we're always looking to connect our listeners with resources and services that can enhance their hospice experience. If your company provides a service for hospice patients or hospice agencies, the Heart of Hospice would love to partner with you to expand your outreach. To discuss customized sponsorship options, send an email to host@theheartofhospice.com. You want your clients to have the best hospice experience possible, and the Heart of Hospice can help you make that happen. Now on to today's episode.
You know this is super nerdy, right?
Yes, I know it is, but it's just so interesting. Which
said the nerd.
Yeah.
Yeah. Okay, so I'll cop to this too. I find it very interesting. The history of hospice is really pretty cool.
I think it is too. So we often use the phrase modern hospice movement. So what exactly is the modern hospice movement, and what was it before? I mean, if this is the modern hospice movement, what was the before?
Because there was a lot of before.
There really was. We think that, hospice is a new invention, and no, it's really not.
No, it's not. It dates way back to, the 11th century.
That's right. So care of the dying was often relegated to the domain of family caregivers, which in some ways it still is, but also the religious orders. So way back in the 11th century, there were often what would be called hospice houses along the roadside. And so people traveling, to and from a place, if they were in a very bad condition, then there were these little hospice houses where they could stay oftentimes until they died.
So are you saying that hospice was actually started by the chaplains? Is that what you're trying to tell me?
They were started by religious people, yes.
Okay.
Not exactly the chaplains.
Yeah, close enough.
So medical care for the dying hasn't always been as popular as it is today. Back then, medical care was really reserved for those who could be restored to health. They could be treated.
People who could be cured.
Right, they could be cured. But those who were terminally ill or considered to be terminally ill didn't always receive medical treatment. And that's one of the reasons why the modern hospice movement really got started.
And one of our favorite people, one of our favorite historical figures, was the founder of the modern hospice movement, a woman in Great Britain, Dame Cicely Saunders.
Yes.
Of course, she was
a nurse. Well, she started out as a nurse.
Ta-da.
Yeah, she was amazing because she started out as a nurse due to some of her own health conditions. She went back to school and she became a medical social worker.
Right.
And then, of course, time goes by. We're putting this all into a very short period of time. But as time went by, she was actually encouraged to go back to school, to medical school, and become a physician, which she did.
That's pretty awesome.
It is very awesome. It really is. And so Saunders was the one who developed many of the hospice principles, hospice philosophies that are still used in the care and treatment of hospice patients today.
Absolutely. Total pain.
Exactly. Yeah.
Yeah.
If you're not sure what we're talking about with total pain, you really should look that up. And we may need to talk about that sometime on the
Ooh, that is a good
on
idea.
the podcast.
So Dame Saunders started St. Christopher's Hospice in London in 1967, and they are still going strong. We actually had one of their joint executives, Mr. Sean O'Leary, who interviewed with us all the way across the water. It's pretty cool.
Yes. And she began spreading the message about hospice to other countries then, including the U.S. In fact, she came to the U.S. in 1963 and did a talk at Yale University. At that talk was the dean of the Yale School of Nursing, Florence Wald. And she was so moved by Saunders' talk that she actually resigned from her position as the dean of the Yale School of Nursing and spent time researching and learning more about hospice. She spent a month at St. Christopher's Hospice there in London in 1969 just to learn all the things that she could about modern hospice.
So Florence Wald came back to the United States. She started Hospice Inc. in 1971 in New Haven, Connecticut, with the help of a couple of physicians, some community leaders, a chaplain. There was a chaplain that was instrumental, and community clergy as well.
So that was the first official hospice in the United States, was back in 1971. Now, we also want to mention another very profound influencer for treatment and care of the terminally ill, and that's Elisabeth Kubler-Ross.
Oh, I love this lady. She was such a unique lady. I've read about her life, one of 3 triplets, a mess, the one that said, I'm not going to be a teacher, I'm not going to be a librarian or a housewife, and told her parents, I'm out, I want to be a physician, I want to do all these things. And she was a very unique lady. Her work was groundbreaking.
Yeah, absolutely. So she began her study of death and dying in 1965 and published her book on death and dying in 1969. And this book was a huge influence on the treatment of the terminally ill by the medical profession.
Yeah, she was one of the physicians on the front lines when it came to treating AIDS patient. That's what we referred to them back in the 80s, when basically what we know as HIV started, when they didn't know what it was. She was grassroots working with AIDS patients.
When no one else would care for these patients, she did. And it was incredible what she was able to do and what she did for the care of these AIDS patients. So the hospice Medicare benefit was authorized by the government here in the United States in 1982. And it was actually set up to be sort of a temporary thing. They were just going to see how this worked. Mm-hmm. Well, in 1986, it became a permanent benefit.
Can we pause and say exactly what benefit means?
Okay, so the hospice Medicare benefit is the payment from the Medicare system to the hospices for the care of a patient who is hospice appropriate.
So if a person has Medicare as their insurance, their healthcare insurance, there is a section of Medicare that's specifically set up to cover hospice care.
Right.
Okay.
Right.
So we just want to make sure that's clear, because there's more than one way to get hospice care in the United States. Medicare is just one of them.
Right. And it's actually the largest beneficiary of hospice care in the United States. So when that happened, when the hospice Medicare benefit began, it was really instrumental in the growth of hospice care here in the United States.
So hospice has been around 50 years or so here in the U.S.
Right.
The foundational models that were created by Dame Cicely Saunders that we built our foundation on here in the U.S., they're still being used today.
That's right. So the hospice interdisciplinary team.
Mm-hmm. Multidisciplines, yes.
Right. That was foundational to that. The concept of total pain that we've talked about already, that's one of those foundational principles, understanding that pain can come from just the physical pain, but there's also emotional pain, spiritual pain, social pain. All of those things are directly influencing how the patient feels.
Also caring for a patient holistically, caring for mind, body, spirit. That's another one of those foundational principles that we still use today.
Right. And the fact that the team is made up of the certain disciplines that we have: a doctor, a nurse, a social worker, and a chaplain. Those are the core team members because we want to provide care for the whole person.
Right.
One of the other historical elements of this is that in the early days, cancer patients were the primary beneficiaries of hospice care. In fact, they were almost the only ones who were receiving hospice care.
Right.
That's not the case today. In fact, in the next episode, we're going to talk about the current state of hospice. This was just the beginning of a short 3-part series that we're talking about hospice in the past, a little history of hospice as it is today. And then in our third episode, we're going to talk about, hospice in the future, what we hope for.
And wish for.
Yes, kind of our wish list of things that we hope to see in the future in hospice care.
Thanks for listening to Heartbeat from the Heart of Hospice. I'm Helen Bauer with Jerry Fenter. Because we know your hospice journey is 24/7, you can always find us at theheartofhospice.com. Subscribe to the podcast wherever you're listening, and please take a minute to leave a rating or a review on Apple Podcasts.
If you'd like to connect with us, you can send us an email to host@theheartofhospice.com. You can also find us on social media. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.